I'd like to talk to you about appropriate use of antibiotics. And there's a huge pressure on us as doctors or nurse practitioners or physician assistants or pediatricians, family doctors, to prescribe antibiotics for the common cold. Frankly, we're going to see that every time it comes up. And even in non-COVID times, there's this enormous pressure to do something. So, and we're people pleasers, so how do we say no to people without making them mad and not feeling bad ourselves and putting ourselves into a difficult situation? So I've got some tips to help you with that. So first of all, we'll start with the history. So say we have a young 25-year-old guy come in, he's totally normal, no past history of any problems at all, really healthy guy, and he's had a cough for a couple of days, it's not COVID. He's no fever, no pain, no shortness of breath, no swollen glands in his neck, just a simple, ordinary cold. And he says, "Doc, I just need some penicillin to get this better." So how do you deal with him? So first we do the history, which we've just done, and then with the physical, first of all we check his ear for temperature. He's afebrile. Then we look in both ears. We look in his throat for redness, bulging of the eardrums, any pus on the tonsils, anything like that. And we feel his neck for nodes. And then we listen to his chest. And we listen to the 4 points of the chest that we're taught to do, in front and back. So 1, 2, 3, 4. Nice deep breaths in and out. And so if everything's totally normal, it's just a viral cold, then I say to them, "Boy, are you ever lucky?" And they'll say, "Why?" And I'll say, "Because you have a virus." And most people don't really know the difference between viruses or bacteria. So I'll say to them, as you know, viruses don't respond to antibiotics. It doesn't cure them at all. So, and antibiotics can do bad things to you. They can kill you, because you can have an allergic reaction and stop breathing. They can give you a skin rash. You can get a yeast infection in the vagina if you're a woman. You can get a sore mouth. You can get a superbug. So it's not an innocuous drug, and that's why it's under prescription. So most people are pretty reasonable, and they'll say, "Yeah, fine," and you can tell them to have chicken soup and Advil and rest and plenty of fluids and, stay away from work and school and stop infecting other people. And then if they still push back and they are demanding an antibiotic, then you can say, well, let's do a rapid strep test. So you can check quickly to see if it's streptococcal throat infection. Or if they still aren't happy with that, you can do a throat culture and say to them, "This will be back in 2 or 3 days. If it's strep, then we'll send you out an antibiotic." Or you can give them an antibiotic prescription and say, "You can fill that when we get the culture back if it's positive." And 99 out of 100 people are totally happy with that, and they're not feeling thwarted, and you're feeling happy that you've followed Choosing Wisely Canadian guidelines. And then always at the very end of this, cover your rear end by saying, if you get worse, or if you're short of breath or pain or sore ear, call us or go to the emerge department. And then if there's still, that 1% that says, we're going to Disneyland tomorrow if you live in Western Canada, or Disney World in Central and Eastern Canada, then you can say to them, well, you don't want or if it's their kids, with diarrhea, in a car or on a flight. So these are nice ways to use antibiotics appropriately.